So today there are 20 new community cases to report. All are in the Auckland region. That takes our total number of cases associated with the current outbreak to 801. Of those, 79 cases are now deemed to have recovered, so our total number of active cases is 722. The ongoing fall in numbers is proving that alert level 4 in Auckland and our public health measures are rapidly slowing the spread of the virus. However, it is not through yet and we need to remain extra vigilant. Ongoing investigations by Auckland Regional Public Health has resulted in the total number of unlinked cases, that are those that aren't either epidemiologically linked or who are not known contacts of existing cases, has fallen from 58 last Sunday to just 30 today, and that work is continuing and the number is expected to fall over coming days. Analysis of yesterday's 20 cases that we announced showed that 75% were contacts of known cases and 55% were household contacts who were already isolating. 6 people from that number yesterday, that is 30%, were potentially infectious in the community but with just 6 exposure events, and none were in essential worker workplaces. The seriousness of COVID-19 infection remains visible, with 38 cases in hospital today across the Auckland hospital network. Of these, 6 are in ICU or in a high dependency unit, and 4 of these patients currently require ventilation. Our thoughts remain with these individuals who are unwell and indeed with their families at what is a stressful time. Sadly, as we reported yesterday in our media release, we reported on the death in North Shore Hospital on Friday of a woman who was a confirmed case of COVID-19. I would again like to just personally express my condolences to this woman's loved ones and whānau and endorse their message, in their words, this is real, and their recommendation of the importance of following public health advice. Lockdowns, following the rules and stopping the spread are critically important to all of us to prevent harm, in particular to those most vulnerable in our community. On the testing front, 9,232 tests processed yesterday, and the 7-day rolling average is around 15,000 tests. I would like to stress the importance of sustaining good levels of testing to help give us further confidence that we are finding any cases of COVID-19 out there. The group that is most important to get tested is anyone with any symptoms that could be COVID-19. Please don't just put this down to a cold or decide for yourself it is something minor. Please do get a test. So saying, 2 weeks of alert level 4 across the country has led to a much lower rate of all coughs and colds across the country because the spread was stopped. So we have got many less people with symptoms in the community, but it is imperative that anyone with symptoms, especially in Tamaki Makaurau, does get tested. On the vaccine rollout, this continues at pace with more than 77,000 vaccinations administered yesterday. We have well over 1.9 million future bookings in bookmyvaccine.nz. If one of those is not yours, now is the time to do so, either by jumping online or ringing the special healthline number.
As you can hear from Dr. Bloomfield's update, we are heading in the right direction when it comes to getting control of this outbreak, but the job is not over yet. As we saw with our first case, it takes only one person to have the virus and silently transmit it over the course of a week for Delta to get out of control. This is why we want to see testing numbers in Auckland increase. We need to make sure that we've got the confidence that the 20 cases that are reported today, for example, are the only 20 cases out there, and that people aren't going about their lives at level 4 with Delta undetected. I could draw your attention to the state of Victoria, which also had their cases come down significantly, but then relaxed restrictions and are now reporting hundreds of cases a day. We've got to do this once, and we've got to do it right. So if you are a contact of a case, you need to be isolating, and you also need to be getting the day 5 and day 12 tests as you are directed. If you've got cold or flu symptoms anywhere in New Zealand, please get tested. Even a runny nose or aches and pains, we'd like you to get a test. It is a small inconvenience to give us all the confidence that we're managing the outbreak down. I'm sure that there's no one in Auckland who wants to stay in level 4 for any longer than necessary, and neither does anyone outside Auckland want to see that continue. With Delta, though, there's no room for complacency. So please, stick to your bubble. Stay under the one roof. And that means no going and visiting your family and friends. Isolate if you're a contact and get a test if you're sick. Let's double down and let's get the job done.